I'm channeling S. Presley Blake today with friendlies, my bow tie. So, do you want sprinkles on that ice cream? He's still going strong, Press. We had a continued good trend that has been reported to me by our commissioner, my Commissioner of Health and Human Services, Helen Kalten Harris. We continue to stay in the single digits for reporting of new COVID cases, and I think that's running, Helen, about 3 weeks now, 3 weeks. So Friday we had 4, Saturday we had 2, Sunday we had 5, Monday we had 1. So our total is running at 3,035 new, these are confirmed cases since we began this ordeal and challenge of defeating COVID-19 coronavirus. We just came off a beautiful long Labor Day weekend, beautiful weather. I hope everybody and your families had a good long Labor Day weekend. Again, I'm so grateful that our medical professionals always take the time to come to our press conferences here, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital Trinity Healthcare, is here, and Dr. Armando Paez, who's the Chief Medicine for Infectious Disease. Dr. Paez, good to see you. I see you on TV. He's pinch hitting for Dr. Mark Kerouac today. And what we will do, as we've done in this recent past, is that after I do my brief update, I will bring up Dr. Roos and Dr. Paez to give their update pertaining to their highly respected medical establishments, and then subsequently we will take questions immediately for those two gentlemen so they can get back to their important duties at Mercy and Bay State. Patrick Leonardo, again, AMR has been a great partner. Thank you, Patrick, for being here, and our thoughts of good health and speedy recovery for your mom, too, on that. So, in accordance, deaths have stayed status quo, which is very, very good. That's going at least two weeks. And to the individuals and family members and friends who have lost loved ones, our thoughts and prayers and sympathy and encouragement go out to each and every one of you, from myself and my staff and cabinet heads all the way down the rank and file. So total deaths are 131. Of that, 57 are white, which encompasses about 43.5%. Black or African American is 31, which is 23.7%. Hispanic, Latino, Latina is 41, which is 31.3%. And Asian is 2, which is 1.5%. Commissioner Helen Kalten Harris indicates to me our senior meals continue to be delivered to seniors who are in need. She will give you, the testing continues to occur, especially for asymptomatic. Helen and I have pushed very, very hard for that, so we're very appreciative of the local entities and Governor Baker, Lieutenant Governor Polito, and Stop the Spread. She'll give you more exacts, but AMRs have done about 1,200, Patrick, I understand, at the Eastfield Mall site, and overall we've done about over 2,500, 2,567, and that encompasses tapestry being used. Back to the deaths again, long-term care facilities holding at 57, residential 74. We had my old classmate, Minister Kim Jefferson Norrington out of St. John's Church. We had a wonderful, it was a beautiful Saturday morning here, downtown Springfield City Hall. We had a beautiful prayer vigil walk with everything going on to defeat COVID-19 and social justice, and we walked, that was from City Hall, St. John's Church, and that went very, very well. I was very appreciative of that. As far as the fire department, Commissioner B.J. Calvi indicates to me there was only one out on COVID-19. He was here earlier this morning, but he had to attend a meeting, so he might be back, he might not be back. They made a big arson arrest on the Red Line, the old Red Line bar. It was a 21-year-old, serious charges because we had 3 firefighters got hurt on that. We have active arrest warrants on car fires and a garage fire, so we know who you are, and we are out hunting you at this current time. It was a quiet weekend on the fire side. Commissioner Clapwood might go into it more. I don't know how much you can say. There was a body recovered from 5 Mile Pond, and they're waiting to identify who that individual, he or she is, and to the family and friends affected, God rest their souls, and our thoughts and prayers and sympathy. As far as the police front, Commissioner Clapwood indicates to me that COVID-19, nobody is down. That's fantastic compared to the early days where we had numerous officers down. Major arrests, again, 3 more gun arrests were made, narcotic raids. Now, this is something that continues to drive Commissioner Clapper and I crazy. These arrests that were made, 2 of the individuals were just priorly arrested for gun charges. So, I mean, what the hell does it take for our court system to hold these individuals? Drag racing, she will go into specifics. We continue to crack down on the drag racing. Again, numerous arrests made this weekend, numerous cars and ATVs and dirt bikes were towed. She will give you a mind-boggling number of arrests that have been made and citations that have been given. I don't know when these individuals are going to learn, but we're going to keep hammering you until you get out of the city limits here in Springfield. I don't wish this upon any other city or town in the area, but it is completely unacceptable, ridiculous, and very disrespectful on that. We did have a murder, unfortunately, that seems to be domestic related. Commissioner Clapper will speak to her best of her abilities of what she can indicate on that. And our thoughts and prayers on the loss there. DPW Chief Chris Signoli indicates nobody's down on COVID. They're going fine, up to speed, which is good news. Pat Sullivan, the Director of Parks and Facilities Management. Sea Arena, again, is going to open up with restrictions September 14th. We also, he's very successful, continues, Pat is very good at pursuing grants, and we continue to pursue grants for many of our neighborhood parks. Duggan Field, which would be the Ted Plum Field, on the Duggan Plateau on Bradley and Wilbraham Ave. We continue on that. Loon Pond, we continue working with that. And of course, Patrick's main focus right now, working with Superintendent Dan Warwick, who's attending a meeting right now, so I don't know if he'll make it back in time, is to continue review of physical plant with the industrial hygienist Bob Kirshner on the review of our schools. Again, we do not have an air quality issue at all. This is under the COVID-19, the new restrictions on airflow and ventilation, so we're going above and beyond on that. My CAFO, TJ Plant Finances, indicates, again, we're down $5.8 million deficit spent since this COVID-19 started back in mid-March, early March. We are down FY21 this fiscal year, $858,000. The deficit overall, because we are starting now to be able to charge down on grants that we have pursued, is down to $4.6 million. My Chief Development Officer, Tim Sheehan, on Echo Dev. The Homeless RFP is out, due back Friday. This was the RFP where we're looking to be creative to assist our police department in their duties with homelessness and mental health issues and how that can be dealt with on the follow-through. So that's what we're looking to do there. I think in the near future, Timmy and I will have some exciting announcements on some other properties within the city limits, downtown, and also in our neighborhoods as we continue to move the city forward and dictate the economic development aspects, even though we're dealing with the COVID-19. School Chief Superintendent Dan Warwick indicates to me we're nearly at 2.7 million meals that have been served, which includes breakfast, lunch, dinner, and snacks. Past weekend, over 101, almost 102,000 meals were sent out earlier because of the long Labor Day weekend. Danny, Superintendent Ward, continues to work very closely with Director Sullivan on the physical plant review with the industrial hygienist, Bob Kirshner. And again, we do not have an air quality problem at all. This is going on COVID-19, ventilation, flow of air. We're going even to a higher standard in protection of our students, staff, and teachers and administration. We will start. School continues the reopening aspects, professional development, the collaboration, reach out to students and families is continuing this next 5 days. Schools will open remotely for the first marking period going in November, September 15th. And again, the reopening is a structured reopening, attendance, grading, the whole 9 yards, including with teachers monitoring and obviously a student and family participation on that. School committee, we had a meeting this past Thursday. We've had a number of meetings and we voted to accept a modified fall sports schedule after the recommendation of Athletic Director A.D. Dwayne Early. And on the legal, HR, labor aspects, regular update from Attorney Bill Mahoney today, and Ed Pakula and I continue to work with retired Chief Justice of the State Supreme Court, Roderick Ireland. We had a great conversation with him over the weekend as we continue to move forward on DOJ and initiatives on our police department. So, without further ado, let me turn it over to Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare. Dr. Roos?
Well, good morning, everyone, and thank you, Mayor. I want to continue to offer my congratulations to you and to your entire team, and particularly Commissioner Kalten Harris, keeping the numbers in single digits. That's tremendous work on behalf of many here in the city of Springfield. I want to thank the media for continuing the regular communication and focusing on the evidence and the facts in this evolving pandemic. I also want to thank AMR, having a chat this morning with Patrick from AMR, and I'm really struck by the incredible work that's happening to continue to expand testing here in our community with the testing that's been occurring through Stop the Spread. So that's tremendous work. I hope that everyone has had a safe and had an enjoyable Labor Day. As you know, while Labor Day is certainly often recognized as the unofficial end of summer, it's also a holiday that has its origins in workers fighting for safe working conditions. And there's been no more important time than now to ensure safety amidst a pandemic. So I'm proud that Mercy Medical Center and Trinity Health have prioritized that safety from the very, very beginning. Safety for our employees, safety for our medical staff, safety for our patients, safety for you. It started with ensuring that everyone had the appropriate PPE. It evolved to ensuring that we test all patients upon coming to the hospital, and it has continued on with now establishing and maintaining our COVID-free zones. So I just want to start with a thank you to all of our frontline workers and first responders who continue to put safety at the forefront, who've done it since the first day back in March all the way until now. We continue to be in a very reasonable spot as we move towards the fall and winter. At Mercy, our numbers remain very low and very stable. As of this morning, we have 2 hospitalized patients, one of which is in the ICU, and we continue to have a relatively low test positivity rate. This past week, it has been just above the state average at 1.2, having performed over 2,400 tests this week and more than 39,000 in total. Of course, this has been a steady progress on behalf of the Commonwealth as well. Throughout the state, the Commonwealth of Massachusetts has seen the test positivity rate decline, and that 7-day weighted average over the past week has consistently been at just below 1%, at 0.9%. We've also seen slowly declining numbers of hospitalized patients, where now across the entire state, there are roughly about 315 patients in the hospital. As a point of comparison, as we think about this now and the day after Labor Day, we were in a very different spot at the unofficial beginning of summer, Memorial Day. If we remember back to that weekend, Massachusetts had a test positivity rate of 9%, and there were more than 2,100 people hospitalized. At the end of May, we were on the downward slope from our peak, as that peak here in the Commonwealth had test positivity rates of over 20% and over 4,000 hospitalized. But it was that week, Memorial Day week, where we just started to begin to reopen some services. In fact, it was on the day after Memorial Day when many hospitals, including Mercy Medical Center, attested to phase 1 of the reopening plan and began resuming in-person services like elective surgeries, outpatient studies, and physician visits. And here in Massachusetts, I think that we've shown ourselves, and we've shown the entire country, that in large part it is possible to reopen safely. That in healthcare, we can care for both COVID and non-COVID patients in parallel with both safety and quality, and that we can have a vibrant and healthy summer, even if it looks a little different than it would have otherwise. So I hope that everyone did follow the recommendations this weekend, and I hope that folks didn't take any needless or unnecessary or dangerous risks with their safety or the safety of others. We've said it before, we know what it takes to get to zero COVID. It's actually quite simple, and it hasn't changed. We need to continue our universal adherence to masking and physical distancing. We need to ensure widespread, accurate testing paired with contact tracing and isolation. And we need to maintain our data-driven approach to guiding our ability to engage in other activities. The hard part, as we've seen throughout the summer in other areas across the country, is that not everyone finds it so easy to follow these principles. The reality is that in the United States, more than 40,000 new infections are still being diagnosed every day, which is actually double what it was back on Memorial Day. There are states where the numbers of new infections per capita continue to rise, and as we approach the fall and winter, there is a concern that this could happen in other places as people spend more time indoors and colleges and schools continue to reopen and move towards in-person education. Unfortunately, my alma mater, my undergraduate alma mater, the University of Illinois, has been a case in point of all the best intentions and policies being undone by a few selfish individuals. For those of you that don't know, the University of Illinois is a large public university of nearly 50,000 students located on a college campus that in itself creates almost two separate towns. Very early into this pandemic, the University of Illinois developed the capacity and the resources to implement a mass testing program where every single student, every faculty member, and every staff member would be tested twice a week in order to gain access to the facilities. The plan included tests that were accurate, results that were timely, masking and physical distancing universally, and a system where all positive cases would be tracked and all the contacts traced and then recommended to isolate. It was hailed as a potential model for how college campuses could safely reopen to in-person classes across the country. Yet, as you may have heard just now, 2 weeks into the semester, nearly 1,000 students on that campus have tested positive. There have been instances where individuals have blatantly ignored the public health recommendations and refused to quarantine despite positive tests, which have led to a few super spreader events. So now the university is instituting a 2-week lockdown, and it's considering whether or not the entire semester can continue with in-person education. And this is happening at a university that's had the tools to be much further ahead even than some other schools. Many schools are testing only symptomatic individuals, and U of I was testing everyone twice a week and catching all the positive tests early, which indeed it has done. So there's a clear lesson. If you get a call from a Department of Public Health or a representative that's performing contact tracing, please answer it. If you have been in close contact with somebody who is positive for COVID, even if you don't have symptoms, please get tested. And if you have tested positive, please heed the guidance and isolate yourself from others and take it seriously. It wasn't until Memorial Day that we started opening up as a community. And we've made it through this summer, making considerable progress. But now is not the time to move backwards. Now is not the time to have things start to shut down. In areas throughout the Midwest, we're starting to see that. It's exactly what's happening. Indoor places now are closing and being banned again as test positivity rates and incidence rates climb. So I can't stress this enough. On this journey to zero COVID, it only takes one. We are in a cultural moment right now where selflessness must win out over selfishness. It's the only way that we are going to continue to keep our numbers down. And at Mercy Medical Center, we remain focused on just that, being there for you, prioritizing your safety. And as we move into the fall and winter, we are maintaining all of our commitments to safe and accessible care for you. In terms of PPE, we've gone to great lengths to acquire enough to keep us and you safe and get us through both the flu and the COVID season. We know that testing has been a constant challenge, and turnaround times have increased in many areas, including our own. So we are going to be expanding our testing options over the next month to incorporate an additional machine and new point-of-care molecular tests to identify infections quickly. We also continue to be very cautious with patients coming to the hospital, including testing everyone and keeping patients who are coming from a congregate care facility in isolation for at least 72 hours until they can have further testing. And I would encourage each of us to be just as cautious and just as mindful of safety with any forthcoming vaccines for the coronavirus. There is a rigorous process of approval through the Food and Drug Administration for a reason, and I would encourage us to ensure that there are adequate studies before widespread adoption. For infections for which we do have proven tested vaccines like influenza, it's essential that we protect ourselves and each other. And so we will be moving towards a mandatory influenza vaccine. And as we all prepare for the fall and winter, it's even more important now for all of us to wear a mask, to sanitize our hands, to keep our physical distance from each other, to be cautious about where we go and who we interact with. And most importantly, let's continue to let science be our guide. Now is the time to be selfless, not selfish. Thank you.
Thank you, Dr. Russo. Being a barber's kid, you have beautiful hair too. Looks great. Now we have Dr. Armando Paez, who again is the Chief Medical Officer, Infectious Disease for Bay State Medical Center. So we're very happy to have Dr. Paez. Dr. Paez?
Thank you very much, Mayor Sarno, for having here. And I would like to echo Dr. Ru's gratitude to all of you who are helping out in this response to COVID-19 pandemic. So my name is Armando Paez. I'm the Chief of the Division of Infectious Diseases under the Department of Medicine. And I'm standing here today for Dr. Carwack, who unfortunately cannot come today. So as you heard from Dr. Ruz and Mayor Sarno, we continue to enjoy the low number of cases, both in the Hamden County and Springfield City, as well as in the state. Currently at Bay State Medical Center, we continue to take care of COVID-19 patients. 12 patients are hospitalized in Bay State Medical Center. 2 of them are in the intensive care unit. And all are hospitalized at Bay State Medical Center, none at the community hospitals. We continue to test for COVID-19 at Bay State Health, approximately 1,000 tests per day. And our positivity rate in our system is about 0.77% for the past week, which is well below the state level as well as New York State for positivity. We have tested approximately 56,000 COVID-19 at Bay State Health. And as you heard from both Mayor Sarno and Dr. Ruz, we enjoy here in Springfield the low level of number of cases. As you know, every Wednesday the state updates a community health report in a color-coded fashion. And Springfield, as of last week, to be updated tomorrow, is at green, meaning there's less than 4 cases per 100,000, which is down from 3.2 from a week prior. There's also overall good performance at the state level in terms of testing, and I heard from from Governor Baker that more testing has been done for younger folks, being individuals going back to school, and particularly in college. I'd like to take this opportunity to update everyone as well for some news regarding COVID-19. Being a clinician myself and helping take care of patients with COVID-19 in the hospital. As you know, even if there's a low number of cases now at less than 1%, it is 100% pain and suffering to those families affected by COVID-19 and have died from this illness. And again, it is a very serious infection. It certainly can lead to death. And I really request everyone to take this seriously, as we have been trying to engage the community to protect ourselves and each other. So as you heard, the vaccine plan has been requested by CDC from the states by the end of October in preparation for possibly fast-tracking the vaccines which may be approved, but we don't know the details of this and when it's going to be coming. But hope is not a plan, and this is something that we should always be mindful of in preparation for the vaccine distribution. The National Academies of Sciences, Engineering and Medicine has put forth a framework for the equitable distribution of vaccine, and this is based on the risk of acquiring the infection, the risk of severe morbidity and mortality, risk of a negative societal impact, and the risk of transmitting the disease to other people. And this consists of 4 phases. The first phase, which includes approximately 50% of the population, that will include the frontline health workers, the first responders, followed by at-risk people with underlying health conditions, and older adults in dense living settings. And it is anticipated that early on, when the vaccine is finally approved for use, that this population will be prioritized. Again, this has not been finalized, and we don't know at this point what will happen. Now, related to the vaccine is the immunity, and there have been news in the past about antibody responses lasting for about only 2 to 3 months. But a refreshing report from Iceland, researchers over there, it showed that antibody response did not decline up to 4 months, and they have approximately 0.3% mortality. However, on the other hand, there is also a report of reinfection. You probably heard that. There have been several reports of reinfection. These are extremely rare circumstances. However, these are real. This is based on the genetic analysis of the viruses that have infected the individual on the first time and the second time. And Dr. Roos alluded to the flu shots. It's very important that we prevent a twindemic. It's really important that everyone 6 months and older should get a flu shot. As you know, another pandemic like a flu or epidemic like the flu can strain our resources and therefore can also strain the ability of the healthcare system to take care of those patients with COVID-19. And lastly, Bay State, is always grateful for its employees. PPE has always been a challenge, and we continue to strive to maintain a safe environment for our employees taking care of COVID-19 patients. And we are very grateful for the employees. And we will be hosting an event. This is the first time we're going to have a virtual event, a 48 hours of gratitude, our first attempt at the virtual employee celebration this coming Thursday and Friday. So my parting words will be, a reminder to take COVID-19 and flu seriously. Let's do the interventions that are proven to work against COVID-19, face covering, physical distancing, and hand washing to stop its spread. Again, thank you very much for this opportunity to talk about all of this.
Thank you, Dr. Pies. We'll now have Dr. Pies and Dr. Roos take any questions or comments coming from the media. And again, I deeply appreciate these highly respected medical professionals, Bay State and Mercy being here. So, any questions at all for Dr. Pies and Dr. Roos? Yeah?
Doctors, over the weekend there was some, maybe there were some arrows in the states that have some wild variation in terms of what the COVID inpatients were at both Bay State and Mercy. I'm curious if A, you suspect that might have just been a data error on the state's part, and B, I was thinking, is there any level of patients that you're seeing who are not hospitalized for COVID, but maybe COVID positive, and are they still being reported as such to the state?
Dr. Roos, Dr. Pies?
Yeah, so all the laboratory test results are automatically, reported to the state. So they know all these cases for all the possible ones. And I just want to remind that 80% of COVID-19 are mild infections, so many of them are not hospitalized.
Thank you, Dr. Pies. Dr. Roos?
Just specifically, I think you're asking about hospitalized patients. We've been consistently at the same levels, week over week with just very low levels. So any day-to-day discrepancy that would vary from that slightly maybe a data error. I can't comment specifically without knowing exactly what the discrepancy was, but can certainly look back at that and ensure. But the numbers that we're reporting and the experience that we're having on a daily basis is very consistently low over the past several weeks.
And are you seeing any level of patients that are in, because if we're not hospitalized for COVID-related disease, but nevertheless positive, and obviously that's still reported to the state as a COVID positive patient in your facility?
Yeah. So just to clarify, if there is a patient receiving any sort of inpatient care at Mercy Medical Center, whether it's related to COVID or not, but they do have a positive COVID test that is relevant and they are considered to be in that infectious period. In other words, it was done during the admission. It wasn't historical from several months ago. We consider that in our numbers. So that is a patient that would be in isolation that is treated as a COVID patient. And so it is included in the 2 that I mentioned this morning.
Any other questions? Paul, TV 22? Okay, to Dr. Pies, Dr. Roos, thank you so much. And good health to you and your families and your staff.
Thank you.
Thank you.
Thank you.
let's see, Billy, where's Helen? Is she? Helen? Okay. Let's take a phone call. All right, while we, Commissioner Helen Kalten Harris must have taken a, oh, there she is, with that beautiful lime green outfit. Our Commissioner of Health and Human Services, Helen Kalten Harris.
Thank you, Mayor Sarno, as always, for your leadership. Very much appreciated. And thank you to the residents of the City of Springfield and the Western region. It is important to acknowledge the work that has been done by the residents in adhering to what we've asked you to do for a very long time. And I know that you are exhausted. I know you're tired. I think we all are. It's been since March that we've been able to hug someone. It's been since March since we've been able to shake hands with someone. It's been since March since we have felt our ability to go outside and just feel the freedom of not worrying about COVID-19. I recognize that we're all exhausted, we're all tired, but your work is paying off. The fact that the City of Springfield has had single digits for almost the last 3 weeks just speaks to the resiliency, once again, of the residents of this city and this region. Knowing that you're tired, I share in your exhaustion, but we must continue to stay vigilant as far as this virus is concerned, because nationally, the Institute for Health Metrics and Evaluation is predicting that by January, there will be 410,000 deaths in the United States. We are now at 189,000 deaths in the United States. And so what that means is there's an anticipation that we will have over 200,000 additional deaths in our nation. That can be prevented if we do the things that you are currently doing. And so it's just where we are, exhausted, but understanding that we are still heading into the wind as far as this virus is concerned. The statewide positivity rate is approximately 4.2%. Our positivity rate in the city is 3.2%, which gives us that green designation, which gives us that designation where we are moving in the right direction. And so it is, again, important that we stay vigilant. Once again, we are heading into a very difficult season. The weather is going to get cooler. We are going to go inside. And getting into inside means that we are going to be closer, perhaps, to our loved ones. And it is also known that we will have individuals in our lives and in our homes who perhaps we're not part of our family. So again, it's going to get darker, things are going to change. We're heading into another phase as far as our residents are concerned. The city is knowing that our colleges are back on campus, students, schools are reopened. When I went around this weekend to the various schools, businesses, people are really doing an excellent job, but there are those pockets of stores, there are those pockets of individuals who are not adhering. I'm going to say that we do have a system in place. Individuals can be reported to the state if they're not complying, and the state contacts us, the Labor Relations Bureau, to follow up, and we do that. And so I'm asking, once again, businesses, as we move into what I'm calling another phase of this virus, because of the weather change, because of colleges being back, because our students are going back to their learning process in their homes, with their families, remotely. So we must, again, be vigilant. There's limited sports, as the mayor said, that is going to be happening. Again, we must make sure that we're protecting our students and ourselves. You've heard from both doctors that flu season is here. We are asking individuals to get a flu shot. We think that that's critically important. But I'm also asking those individuals over the age of 65 to remember, if you have not had a pneumonia shot within the last 5 years, think about getting one. Check with your primary care physician to make sure it's safe for you, but individuals with underlying conditions should have a pneumonia shot as well. So we are asking you to do that. People with underlying conditions, again, should make sure that you are taking care of yourself and doing everything you can to adhere to the standards that are in place currently. Travel restrictions, we know that Oregon, Washington State, and Wyoming have been added to the travel exempt list. And so, Colorado, Connecticut, Delaware, Maine, New Hampshire, New Jersey, New York, Oregon, Pennsylvania, Vermont, Washington State, and West Virginia, and Wyoming are those states in the Commonwealth where if you're coming from there, you do not need to self-quarantine for 14 days and you do not need a negative test result. However, the other states, we are still encouraging individuals to follow the mandate from the Commonwealth. We have had over 150,000 individuals fill out the travel form. There are individuals in our state who are complying with this request. And we want to continue to do our trajectory where we're seeing our cases go down. The two maps that you see here really does show the flattening of our curve. And so you can see the high points and you can see we have steadily gone in the right direction. And again, I'm encouraging us to go there. The top map shows all of the cases in the city that we have had mapped geographically. And you can see that there are some places in the city that had higher case rates than others. We are tracking in this city, still tracking clusters. We know that there are zip codes where there are higher prevalence rates, and so we're working with our community-based organization partners as well as others in the community to do outreach to those individuals in those zip codes. It may be just as simple as showing someone how to wear your mask correctly. What do we mean when we say social distancing? That might not resonate with everyone. Using language like physical distancing, hand washing, just making sure that we are using languages that our community will understand and adhere to. So we continue to work with the residents in the city. I continue to work with this amazing cabinet that works with me and for Mayor Sarno. We work together. We are trying our best to get all of us through this very difficult time while we're understanding that substance abuse disorders are still something we're concerned about. Homelessness is something that we're still concerned about. Chronic diseases are something that we're still concerned about. So while we're focused on COVID-19, we understand there are still public health needs out there, and our staff continues to work to try to mitigate those things as well. So we continue to work on all phases of public health while we are attempting to defeat this virus. Charles Dickens said, "It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness." The age of wisdom says, wear a mask, do hand washing for 20 seconds, stay away from individuals for the 6 feet. Act as if a person you don't know has the virus. Act as if someone who's in your environment that you don't know is COVID positive, even if they're not. So we want you to act in the age of wisdom, do the things that we're asking, and so we do not act in that age of foolishness. Thank you.
Thank you, Commissioner Helen Kalten Harris. I thought I was back in English class there, High School of Commerce or Kylie Junior High with Dickens there. Very good.
Stop the spread.
Yes, come on back up here. She's now going to quote Aristotle now. So. Come on, go ahead.
I just apologize. I really wanted to get that age of foolishness message out there. But I want to just talk about Stop the Spread. And I do want to thank AMR. I want to thank Tapestry Health. I want to thank Fallon Health for being our partners in this. So Tapestry will be at East Forest Park Library on Wednesday, Van Sickle on Friday. AMR is out Eastfield Mall daily from 8 to 6. Fallon is going to be on the campus of Springfield Technical Community College September 9th, 9 to 4, the September 10th, 10 to 4, and Friday, September 11th, 9 to 4. They will be at STCC on Lot 3, 460 Union Street. And so again, over 2,567 Springfield residents have been tested, and we just want to thank again those partners who are standing up sites, and we want to thank Governor Baker for his work in the Stop the Spread initiative. Thank you.
Thanks, Helen. We'll be giving out Charles Dickens books also at that point in time. Joke that was a good quote. I like that, Helen. We're just kidding on that if you're coming for the Charles Dickens books. We're now going to move into the public safety component of the press conference, and I will have the Police Commissioner of the City of Springfield, Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning, everyone. The police department right now has 0 out with COVID, so we're not affected by the COVID virus at this time at all. Over the weekend was very busy, was very steady. Narcotics officers on Friday afternoon, as the mayor mentioned, made 3 arrests, 3 individuals with handguns. Nathan Mercado, Gregory Critchlow, and Michael Bedinelli were all arrested, and semi-automatic handguns were seized. As also mentioned, Mr. Mercado and Mr. Critchlow both have prior gun offenses on their records. So we continually deal with people who are arrested for serious crimes back out on the street. The anti-drag racing detail, 6 arrests over the weekend. These arrests were at Northgate Plaza, Riverfront Park, and the 2400 block of Main Street. We issued 3 criminal complaints. Numerous cars, motorcycles, and dirt bikes were towed. For the last 4 weekends, the Springfield Police Department has had 32 arrests, more than 100 motor vehicle citations, more than 40 ordinance violations, more than 25 cars and dirt bikes towed. The vast majority of these arrests are for unlicensed operation or unregistered motor vehicles. Saturday morning, also unfortunately, there's an unattended death. There was a body pulled and retrieved from 5 Mile Pond. At this time, we are awaiting dental records to positively ID who that was. There was a murder also Friday night, 11:50 p.m. Cortlandt Street, shot spotter went off, officers responded. 1 male succumbed to his injuries, 1 female was injured. This investigation is very fluid and ongoing, but at this point in time, it does look like it may be domestic related. Tomorrow afternoon, I'd be proud with the mayor to pin 10 new sergeants for the department, a new lieutenant. So the ranks of my supervisory additions will be completed, and that's necessary because we have 33 new recruits who came out April 30th, who have completed a training cycle throughout the department, 3 weeks in every location that we could put them in. They are now transferred to where they belong. Most of them are on midnights. Some went right to the 4 p.m. to 12 a.m. shift. And there are officers now on days with less than 3 years. It's kind of unheard of as far as experience goes. So I wanted to make sure the supervision ranks were full. It's important. It's a young department, and I wanted everybody to have good advice, to have the right advice, to have help when you need it. And those are usually the sergeant levels, so we'll pin some new sergeants tomorrow. So I thank you, Mayor, for that. And that's about all I have for today. And for Commissioner Calvi, him and I have been in contact, and we did make a good arson arrest, and there are warrants pending for others out there who have committed arson. So thank you.
Thank you, Commissioner. Thank you, Commissioner Clapprood. And again, I gave Commissioner Calvi's report. He has to attend a meeting. He is going to try to get back here if possible. If not, his report has been given. On the forefront also has been our school department and Superintendent Dan Warwick and his team and the teachers and administrators have been working very, very hard. I just got word that the Hartford Public School System, their computer system was attacked. We're already taking proactive measures in the Springfield Public School System to not have that happen here on that. So without further ado, Superintendent Warwick will come up and give the update on our school system. Superintendent Warwick.
Thank you, Mayor. Good morning. So on our meals program, we're now at 2,690,942 since this pandemic struck us. And we're still distributing for the weekends for now. We're trying to get the waiver to continue that. Just this weekend, we distributed 101,904 meals. So that program's been a huge success. We do have a waiver to continue it during the week, and starting next week, we'll be going Mondays and Thursdays, 2 to 6, again from 17 different locations. So we're able to keep that program going. We're also going to try to get a waiver to continue on the weekends as well. As we've said before, we had an extra 10 days that DESE allowed us to create extra professional collaboration time for staff to get ready for our remote instruction. We'll be working those next 5 days until 9/14 with staff working together to prepare plans in every building, and then reaching out to families to work with every family to engage that family in the remote learning process, because it really is a process between the family and the teacher. So every family in Springfield can expect calls from the school to, again, develop that relationship and start the remote learning process, which will begin on Tuesday, September 15th, following our normal schedule for every school. So every school will be on their normal schedule. There'll be a precise schedule for remote learning, just as there is when we have traditional classes. We're very fortunate here in Springfield. We're going to be distributing more laptops to folks who need them, but we were able to distribute 17,000 last spring. And with the support of the mayor and his team, and I want to thank the mayor, he's been just a tremendous education supporter. We have laptops for everyone, and we're also now have purchased iPads for our preschool students. So they'll be available for distribution as soon as we get those in. So the laptops are already here, and each school is going to distribute them accordingly. We're also, for a family who can't go to the school, we'll actually use our transportation system to actually bring the computers to each student's house. During the first quarter, the school committee voted to engage in remote instruction, and with the support of Pat Sullivan and his team and Helen and Kalten Harris from our public health department, we decided to go remote while we have an industrial hygienist look at every one of our buildings. Again, we're talking about airflow or air movement, not air quality. The air quality in our buildings is fine, but we're going to take a look at that before we have students make a decision relative to whether they come back to school. So for the first quarter, again, we're going to be in remote instruction while that analysis is being done. As the mayor said, Hartford did get hit with an issue with their IT department, and we've put a lot of precautions in place. No one is immune to these issues, but we've built a lot of safeguards into our system to keep it running, especially during this time. Thank you.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick. Thanks for all your efforts and your team's efforts and our teachers and family and students. And again, The air quality is fine in our schools, as the superintendent indicated. We are going above and beyond pertaining to COVID-19, and you have to remember we've sunk in well over nearly $620 million in building new schools and rehabbing older schools on it. But we want to make sure that we have a safe environment for any and all that traverse our school halls. We're now going to, speaking of that, I will segue to Pat Sullivan, who's the Director of Facilities Management Parks and has done a tremendous job, and Pat will give his update. Director Sullivan.
Thank you, Mayor. As the Mayor stated, Sea Arena will open September 14th. That will be for drills and practice. Drills only. Public skating will not commence this season. Our splash pads will remain open through September 13th. It's supposed to get hot and humid towards the end of this week. And I just want to thank our Commissioner of Health, Helen Kalten Harris, and Commissioner Clapproot in assisting. Commissioner Clapproot had officers stopping by at the splash pads for the season. And going by, it was great to see the families enjoying themselves, but also observing the COVID regulations. As stated, the industrial hygienist has completed the reviews. They are now running the calculations on each building. And just a shout out to our facilities team, John Kerrigan, the zone chiefs, to Dan Warwick's team, Pat Roach and Bob Mulcahy. They were tremendous in getting the on-site visits done. And we hope to have some information over the next 3 weeks on next steps. On non-COVID related items, Emily Bill Park was completed, and the state signed off on that project last week. That will open to the public early next summer. Walsh and Kennefic Park projects, bids have opened. Those will start over the next month. And then just on the Ruth Elizabeth Park project, that's really looking tremendous when you look at the Walnut Street, and congratulations to Chris Signoli and his team. They're getting the Central Street project portion of that started, and to Tim Sheehan, Kathy Bono, and Tina Quagliato. They were a great resource in making sure Ruth Elizabeth and Central Street happened. Thank you.
Thank you. Thank you, Director Sullivan. Now we'll, our day-to-day operations, Department of Public Works, DPW Director Chris Signoli, and a lot of things that we take for granted have continued on, even though we've had this COVID-19. So without further ado, the Department of Public Works Director Chris Signoli.
Mayor, thank you. With regard to the DPW, we are at full staff with regard to COVID, no employees out. We have a number of employees who are out on workman's comp, but all of our services are on time starting this week, and we made it through the last 2 weeks pretty much on time. As Pat mentioned, we do have a number of construction projects going on, Central Street being one of them, as well as a number of other construction projects in the city. I hate to say it on a day that's going to be in the 80 degrees, but basically Labor Day we start doing our winter planning, and for people who are interested to be snowplow contractors for the city, those advertisements are available today. They will be posted on our website, on our Facebook page, as well as through the procurement office with the city. That is it with regard to DPW. Thank you, Mayor.
Thanks, Chris. What was that old line? Say it isn't so, we don't want any snow, Chris. You snow miser, you. Again, Springfield's in the business of doing business, and Tim Sheen and his team, our Chief Development Officer, done a tremendous job. Two quick things before I bring Tim up also. We discussed that we're going to continue to work with our restaurants. It's been very successful on the outside dining, keeping tabs on that and trying to pop in. And as long as the weather stays warm or applicable, we will work with them as long as we can, not knowing. We await Governor Baker, Lieutenant Governor Polito, on if restrictions will continue to be lifted on interior attendance in these restaurants. So we're going to continue to work with them. And on a side note, again, just to reiterate, conversations with Roger Crandall, Mass Mutual, over the past long weekend, and again, their continued strong commitment here to the city of Springfield as they have made some adjustments pertaining to the retirement division. That was obviously shown with the commitment to our 31 Elm Court Square project. So again, Mass Mutual, continued strong commitment to Springfield and here to stay, as that has just been recently reported, I believe, early this morning on that. Without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thanks, Mayor. As the mayor indicated, we released an RFP for services for the homeless population. It went out the end of last week. The responses are due back in for Friday. This particular request for services is to do outreach. It should come as no surprise that the homeless population has concerns about congregate living conditions in the shelters, so the service provider will be doing outreach, counseling, and rapid rehousing. I also wanted to mention, we, as the mayor said previously at numerous press conferences on this, the city put forward a significant amount of its resources from the CARES Act to deal with mortgage payments, rental payments, and utility payments. I encourage anybody that's had an economic change in their incomes due to COVID to actually contact Wayfinders and not wait for the moratorium on evictions to occur. We want to keep the economics of our housing sector healthy, and providing those rent payments and mortgage payments does so. But we really would encourage people that have a problem to contact Wayfinders or contact the Office of Housing so that we can get you in the queue and get you straightened away prior to the eviction moratorium being lifted. Thanks, Mayor.
Thanks. Again, you heard I gave the update pertaining to Fire Commissioner B.J. Calvi. Again, he's at a meeting, so it might be difficult for him to get back to City Hall. The legal HR labor update is pretty much status quo, and I gave you the financial update from CFO TJ Plant. So at this point in time, we'll take any questions or comments pertaining to my cabinet heads or myself. Paul? Commissioner Helen Kalten Harris, please.
The Stop the Spread initiative ending this week, the funding for it this week, is that correct?
The Stop the Spread initiative was originally supposed to end on September the 12th. There is a request that it be continued until September 30th. Patrick, have you heard whether that extension has been
That has been granted for the city of Springfield. We do the number report and we will continue at your request.
There's your answer. So we did request that it be extended. Each municipality had to request independently. The city of Springfield did request that it continue, and apparently that has been granted.
It's just, can you talk a little bit about that? You mentioned the numbers that have been tested. What's the been the response to this? People been showing up to be tested?
The response has been excellent. We've had the fewest that I have seen, the data come across was that 85 individuals. That was the least. The most I've seen was 121 individuals. So the response from the City of Springfield residents, but remember, Stop the Spread is not just for Springfield residents. You can set up or stand up a site, and anyone across the Western region or the Commonwealth can come to the Stop the Spread initiative event.
Thank you. Any other questions or comments? Sure. Superintendent Ward, please.
Superintendent, I've heard both you and the mayor talk about the cyber attack on Hartford. Given that something, Springfield's going forward with remote learning and computer
Well, you know, we've always been afraid of a threat of some kind of cyber attack, and we've put a lot of systems in place over the years before the decision to even go remote, because it's always been a threat. And, you know, we have audits done, and we put protections in place, not to say we're immune from a possible problem, but we have put a lot of systems in place to protect us, and it's something we're always vigilant on.
Is this event in Hartford, is that something that's similar to what you would be dealing with here, or as far as they're doing remote learning, and it would be a similar situation to what Springfield is doing?
You know, I think most systems have some similar situations, but we've invested a lot in technology, a lot in our infrastructure, and a lot in backup systems. So we're hoping that'll protect us from this, but there's always that threat, and we're always vigilant about taking a look at ways to protect the system.
What's being done to adopt special education?
So every special ed student is going to have their own remote learning plan that's going to be shared with a parent and executed. So our special ed teachers and paraprofessionals are going to be online delivering those services. All the ancillary services, speech language therapy, everything else is going to be again delivered through teletherapy. So all of our students will be getting the services prescribed in their individual education plan, and they're all getting a remote plan developed for them.
Everything going to be ready to go in a week?
We're absolutely, yep. That extra 2 weeks that DESE put in place for professional collaboration and planning really gave the staff some extra time. And remember, we have 5 professional days before the school year begins. So our folks had 15 days to get together and really plan to execute. And we're going to be ready to execute for our students.
Thank you, Superintendent Warwick. Any other questions or comments? Okay, hearing none, I really want to again thank the media that continues to be here every Monday and every day to make sure that we get this important information out. I want to also thank Dr. Roos and Dr. Paez, who are here from Bay State and Mercy. And you can, we need to heed their advice, as also the advice of Helen, Kalten, Harris. We're seeing in many other states across the country that, and I've said it from the beginning, I don't want to take one step forward and end up taking 2 steps back, who have now moved to close down mode. So what we're doing is working. And then, as Helen indicated, is it tiresome? Is it aggravating? Is it wearing? Yes, it is. But the numbers that we're showing by wearing masks, socially or physical distancing of 6 feet, making sure we wash our hands. If you don't feel good, stay home. Putting some restrictions as we're trying to balance echo, dev within reason, and hopefully we can relax them, is paying dividends. And we need to continue to do that. The last 2 weeks, if not 3 weeks, we have stayed in single-digit, really single-digit reporting, which is tremendous on that. And I just ask and I thank all my cabinet heads all the way down the rank and file. Tested and true. They've done a tremendous job. As with Helen's outfit, we want to stay in the green and then move to another appropriate color. And as Governor Baker had indicated when he announced personally at the big 31 Elm Court Square announcement, that, you know, really tremendous feather in our cap for a mid-sized city in America to be in green, and so we don't want to go backwards. But it's a testament to each and every one of you who are viewing this, listening to this, reading about this, the residents and business community here of the city of Springfield, because you're working with us, and with this collaboration, we will defeat this COVID-19. So we're going in the right direction. Let's continue that movement. I deeply appreciate your patience, understanding, and collaboration. Go out and have a great day. God bless. Thank you.